And welcome back to Talk Story with House Majority. Again, my name is Della Al-Baladi and I'm House Majority Leader. So we're trying to do things a little bit differently today because it's so busy here at the state capitol. I'm taking questions from viewers. You can post it at the facebook.com/Olelo community on the live stream. I'm going to be giving the questions from my staff, and I'm also getting questions coming in from messaging. So I wanted to respond to one of the first questions that are kind of top of mind since this developed as of last night. Question came in that said, what are your thoughts of the Department of Justice supporting the lawsuit against Governor Ige's 14-day travel quarantine? So I haven't been able to take a look at the pleadings, but my belief is that the orders being imposed are to protect the public health, safety, and welfare of our community. And that is precisely in the realm of the state authorities to do. So it's interesting to see that the federal government is weighing in as states are really the ones responsible for ensuring public health, safety, and welfare. As we talk about this, other states in the nation are starting to impose and tighten their quarantine orders. So I think this is going to be an interesting interplay between federal and state powers. And my belief is that, Governor Ige does have the authority under emergency powers to be able to impose these orders. So thank you for that question. We have a question from my Facebook friend, George White. Thank you, George, for always kind of staying tuned in. The question is, why has DOH adamantly refused to implement a statewide testing plan or protocol or even support expanded testing in our elder care facilities and care homes? So I don't want to speak on behalf of the Department of Health. I can only say what I believe might be their position and also what I think is the reason why there has been limited testing. And let me start out by saying also that the question of testing has been somewhat of a controversial point for a number of reasons. And I think one reason why there is limited testing is for three reasons. First of all, it's the efficacy of testing. And we've seen this. We know that many of the tests are not reliable. They are point in time tests. So what they're telling us at any one point in time is only what is the state of that person at that time. We know that COVID-19 is transmitted when people are asymptomatic. So a test given to a person on day one could be a negative, but in 3 days' time, they may be positive. So for people who support widespread testing, I would agree if we had unlimited supplies and unlimited resources. So that goes to the other two reasons why I also think that there has not been expanded daily testing of everybody who wants to get it. It's secondly, the availability of supplies and the cost of testing. So for example, we know in my community with Halenani, where there is now a cluster, in order to test all of the staff there, once a cluster is identified, you're talking about 750 to 1,000 tests a day. In the state of Hawaii, the capacity for testing is 3,000. So right there, we demonstrates that we need to test where we need to test, when we need to test, when we know we need to test. And that goes to George, your second question, I think. What is being done to ensure that our most vulnerable but resilient kupuna are also being protected? I think there are levels and layers of protections that are being offered to our vulnerable communities. The first level of protection was, of course, the shelter-in-place orders, where we really asked everyone to stay in place so that we could understand where this disease was. And then we also saw, rules being imposed upon places where we knew there were vulnerable communities. So as much as it's been really hard for families, the rules where you're not allowed to have visitors is something that's really best practices in places like nursing homes. And then, of course, when and if there is going to be a positive test, then DOH really, really ramps up with the contact tracing and the testing. So now we're almost seeing daily testing happening at places like Halenani. I think one of the things as we move forward is that testing is still going to be a critical and important piece in how we deal with COVID-19. But as we hear for calls for more testing, even for pre-testing of travelers who come in, knowing that if they come in without a test and that they may have to be tested 2 or 3 days later, the cost can get exponentially higher. So I did a little bit of a calculation, and if we assume just 3,000 travelers coming in, we look at the example of Alaska, where 25% of the people who are coming in now come in pre-test, but that means 75% don't. When you do the calculations, for those 2,250 who may not be tested, and now they need to get 2 tests within our state, you're talking about $450,000 per test for those people who are not tested. In a month's time, 3,000 travelers coming in, that's $13.5 million for testing. So it gets very expensive in terms of monetary resources as well as supplies. And I think we all know that we'll be living with COVID-19 for at least a year until we really have a vaccine that can help protect the community. I'm seeing other questions roll in now. I have a question. Can you please comment on why the legislature is declining to consider the recommendations of the Hawaii Health Authority? I believe that some of the recommendations coming out of the Hawaii Health Authority have been echoed, basically to create a system, a self-insured health system. That is a larger question about what we're doing with our healthcare system. And so at this point in time, that's one of the reasons why the Hawaii Health Authority's recommendations are not being taken up. In addition, some of the things that the Hawaii Health Authority is recommending, we need to look at what their recommendations are in connection with EUTF, with our Medicaid system, and with our other insurance systems like Medicare and the private insurance system. So that's one reason why those measures are not being taken up. I see another question here coming from Mr. Smithy. Alan, thank you for always paying attention to Talk Story with House Majority. His question is about the collective bargaining bills that the legislature is taking up to fund pay raises for public workers. And how do we justify these collective bargaining bills at a time when, we know that other people in the community are hurting? My response to this is that 3 things, really. Our government employees, as you heard Tim Sakahara say, really are the frontline workers in tackling COVID-19. We have nurses at our public hospital systems. We have social workers working with our homeless populations. We have the airport employees who are doing all the important screening, and we have the DOH contact tracers. So really, these are essential workers who we need to ensure that they are paid. Secondly, there's 2 economic and procedural reasons why we should also be doing this. Collective bargaining is a complicated process, and the way it works is that there's arbitrations, there's the governor sending down his request, and the legislature's role is really an up and down vote. And in this instance, the governor provided us with those awards. They will go into collective bargaining next year, but for us as a legislature to insert ourselves at this point in time would set a very, very dangerous precedent in the collective bargaining process. Now, the third reason why I think it's really important that we move forward on these collective bargaining bills is for economic reasons. UHERO has come out and basically recognized that one of the things that we have to shore up are the public sector. Furloughs and worker cuts actually can do much more damage. And what we really need to be doing is infusing funds into the community. The legislature is doing that by ensuring that CARES funding is going to be getting out to those people who are hurting in our community in the form of unemployment, weekly enhanced benefits when the federal benefits fall off. We are looking at rental assistance. But another thing that we have to look at and to ensure is that the sectors that are remaining strong in our community, we have to make sure that they stay strong. So those include the construction sector as well as government. Once we start to impose furloughs and pay cuts at this point in time, we could actually be causing and contributing to the continued economic downturn within the community. Now, moving forward, of course, collective bargaining is a process that is ongoing. So it's going to go back to the governor and the unions. And, I think as we see this continue to play out, just as we saw with collective bargaining following the Great Recession and those downturns, there's going to have to be conversations that happen between the executive and the unions to really understand, because if we're in this same situation where we're facing the kind of the downturns that we're seeing, then clearly there's going to have to be conversations. And that is, again, part of the collective bargaining process. So I'm seeing that we're running out of time. I really, really want to thank everyone for their questions. I'm sorry if I didn't get to your question, but we'll take a look at that and see how we can respond in future Talk Stories. I want to again thank Tim Sakahara for joining me on this episode of Talk Story with House and Majority. It's more important than ever that we stay connected and informed during these uncertain times. So if you're new to the show, please follow the House Majority on Facebook, Instagram, and Twitter at High House Dems for the most recent updates and future episodes. The legislature will be continuing to meet. We're projected to adjourn on July 10th. You can also visit our website at HawaiiHouseDemocrats.com to stay informed. It's got lots of resources, press releases, and valuable information on how the House Majority is responding to COVID-19. Please stay safe, stay healthy, and stay informed. We'll see you next Wednesday to Talk Story with House Majority. Aloha.